good morning, everyone. Okay, very good. So what I wanted to do is provide a brief talk, and I think the title of my talk is A New Mindset. And what I wanted to share with you is a journey, okay, a journey of the past to the present and onto the future of manufacturing and manufacturing facility through the lens from an individual within an owner engineering organization. Now, this journey starts back in 1980, okay, when Amgen was founded here in Thousand Oaks, California. A group of scientists and venture capitalists with an idea and a conviction formed this company, and the company evolved over the years to what it is today. The mission back then, as it is today, is very simple. It is to serve patients. It is to serve patients by discovering, developing, manufacturing, and delivering cost-effective medicines using biology. Through cutting-edge science, it has led to 12 commercially approved products on the market today. And if you look to the right, those are the names of the products that are shown of the products that are on the marketplace. Next slide, please. The 12 commercial products, okay, are manufactured within our manufacturing network, okay, and I provided some photos to share with you what that representative facilities and campuses look like. This manufacturing network includes drug substance and drug product, and these facilities are distributed in the United States, Puerto Rico, Ireland, and the Netherlands. The latest drug substance facility will be operational soon in Singapore that captures some of our latest thinking and flexible manufacturing. These facilities were built for this network that was indicative of the thinking and the realities of the time period that it was built, a period where speed to market was critically important. However, with the realization that it took 4 to 5 years to design, build, commission, qualify, train, and to start up a facility, a period where facilities were fit for purpose for high volume single products, and where cell culture capacity was driven by low titer output in a fed batch process. If you look to the photo on the bottom right, which is fill finish, the conversion of drug substance to drug product had products where batch sizes can run up to 400,000 units with large fixed assets. Next slide, please. Moving forward, our business landscape has changed. Engineering organizations like ourselves, working with our internal process development organization and with outside suppliers, must rethink of what we built and how we go about building it. This changing landscape is driven by, from our perspective, biosimilar competition. We have products coming off patents and will experience biosimilar competition in the U.S. in the near future. Secondly, our strategy to expand internationally will require us to increase our geographic footprint, especially in countries where governments require local manufacturing. You know, we have a competitive landscape in many therapeutic areas where companies has forced and created a crowded marketplace. Fourth, when it comes to reimbursement, the reimbursement landscape with emphasis on comparative effectiveness research, healthcare reforms throughout many geographic regions and governments, and value-based medicine is reshaping the marketplace. Fifth, evolving regulatory expectation. And lastly, here at Amgen, we're getting more involved in drug product devices, and this has transformed us into a combination drug company. So with these business changing environment, it's forcing us to shift our paradigm, a paradigm where reducing the cost of manufacturing is paramount. A decade ago, the cost of manufacturing represented a small marginal expense to the business. However, those cost dynamics has changed, and it's changed quickly. Reducing life cycle facility costs, which requires us to optimize capital investments. And from a balance sheet perspective, we need to optimize our return on asset. We need to reduce inventory levels. And lastly, rapid deployment. We need to respond quickly and we need to be flexible. Facilities need to be flexible around molecules and market volumes, and those are essential sort of shifts that we need to address. Now, with these paradigm shifts, it also requires a new mindset, a mindset that is faster, leaner, and nimbler. And how we go about doing that is basically intensifying the process. You know, if we intensify the process, we could decrease the equipment footprint and possibly leverage commercial off-the-shelf equipment. We need to simplify the process, reduce the complexity. We need to think really hard to reduce the complexity, as complexity is the enemy of reliability. We need to start thinking of running continuously. If you look at all mature industry, continuous manufacturing is a sort of the next step to the evolution of thinking. Robotics, you know, we have to leverage robotics. Is there a way to leverage this technology, for example, in a aseptic filling to drive flexibility and reduce change over time? And if we could accomplish some of the elements that's mentioned above, then integrating a flexible manufacturing facility in a plug-and-play format is probably achievable.